Hello, welcome back again to this channel where we talk about the basic medical information making a big difference. The kind of information we are talking here in this field, or the medical field, we want or we like to get as much as information in regard to the conditions which come around us. Maybe you have a medical or a condition which needs to be looked at. So some people want to know what is really happening, what is causing this. In this channel, we give information, but we do not treat. This information can help you get to make the right decision or get to know who to see when you or your loved one has a certain issue. Now, if today is your first time here, don't forget to subscribe. And if you are a returning subscriber, thank you so much for always coming back to check on this channel. And my name is Rebecca Moranki, and this is the best place to be. We have been talking about the thyroid gland. In the first video we did the introduction of the thyroid, where we looked at the anatomy of the thyroid and what it does, or the functions of the thyroid. We came and looked at how the thyroid gland affects all, connects with other glands in the body, and that was the hypothalamus, the pituitary gland, and the thyroid gland itself. Recently, we did another one on the disorders of the thyroid gland, where we looked about 5 disorders of the thyroid gland. And today, we are going to look at one of the disorders. So kindly, if you have not checked those videos, go back and get to have some information on the thyroid. Today we are going to look at the condition we call hyperthyroidism, or what we call overactive thyroid. What do we mean, or what does it mean when we say hyperthyroidism? This is where your thyroid gland releases or produces high amount of thyroid hormones than the body needs. Thyroid hormones, we have the T4, T3, and the TSH. Now, when we say you are hyper again, how can the doctor get to examine this? Now, most of the people, when they have some symptoms of which they don't really know, they go to see a specialist. If you are lucky to know the first step to take, some they go to see the thyroid surgeon, others to see the endocrinologist, others go to the general doctor. You can decide to go and see the ENT. Now, when you go to this, either one of them, they can do what you call the medical and physical examination, or do what we call the blood test. In the medical and physical examination, some people present with tremors in their hands or fingers. Others, they have what we call a rapid or irregular pulse. Others, they have what we call warm or moist skin. Others can present with eyes bulging outward. Not everybody, but people with thyroid condition, some of them present and not all of them, because this is something which comes up at any point of life, of which you are not born like that. The doctor can decide to tell you to swallow saliva so that you can get to see if your thyroid is slightly enlarged or it has a pumpy look. Now, those are when we look at the medical history and the physical examinations. Now, what about the blood test? Here, a blood sample is taken and then they get to check the levels. Thyroid hormones should be between a certain range medically. So when the test is done and they get to get that the sample results are slightly higher than the normal ranges, in most cases, when the T4 is high and the TSH is low, that is when you have this condition we call hyperthyroidism. So blood tests, it's one way of, in most cases, which can be used in connection with physical symptoms to get to make the diagnosis. And in older patients, most of them do not show any symptom. Now, for them, they do the blood test. But again, blood test can give false results. That in the case is the case when you are taking a multivitamin we call biotin, which actually in most cases gives false results if you are taking it. And the reason is not actually known because it does not affect the thyroid hormones or the way they function or the thyroid gland. But the research shows that it affects the thyroid results, especially the blood, when they do the blood work. What does that one mean? It's good to give your history to tell the doctor if you are taking a certain type of vitamin, so that can be able to know whether that vitamin has what we call biotin. Now, what are other ways maybe the doctor can use to diagnose this? Oh yes, we have what we call the thyroid ultrasound, or what we call the radioactive scan or uptake test. Now, the thyroid ultrasound, in most cases, it uses what we call high frequency waves to show the image of your thyroid. Those who have gone through this process, they actually know what I'm talking about. Now, this one can be the best when it comes to test pregnant women and those who are breastfeeding. Reason being, you are not exposed to radiations. No exposure to radiation. Now, what about when we talk about radioiodine scan? The radioiodine scan or uptake test. This is where you are given a small dose of radioiodine and they get to know how it collects in your thyroid. When you take this small dose of radioiodine, if it collects in high amount in your thyroid gland, that one means your thyroid is producing high amount of thyroid hormones, or your thyroid is overactive. And in most cases, this comes when somebody has a condition we call Graves' disease, which is an autoimmune condition. And also when somebody has what we call thyroid nodules. Remember, thyroid nodules, we said these are lumps in your thyroid. And what if now you have taken the radioiodine, in small doses, and then it collects in low amounts. That one means the thyroid hormones are leaking into your blood stream. So it's good to know that difference. When it collects in high amounts, that is, your thyroid is producing high amount of thyroid hormones. When it collects in low amounts, your thyroid is producing, or your thyroid hormones are leaking into the blood stream. Now, in summary, how can we summarize this condition we call hyperthyroidism? For you to have this condition, or some of the causes in summary which can cause you to have this condition, one is what we call the Graves' disease. That is an autoimmune condition. Another cause can be thyroid nodules. If you have thyroid nodules, they can cause you to have this condition. If you have what we call thyroiditis, the inflammation of the thyroid, that one can cause or can make you to have this condition. When you are treating a condition we call hypothyroidism, when you have low amount of thyroid hormones in your body, now you have been given medication to treat this condition, it can lead to hyperthyroidism. Now, when you have high amount of iodine in your body through diet, it can cause you to have this condition. Or if you have another medication you are using, high amount of iodine in blood, all in your body through the diet you are taking, or treatment of using some kind of medication. All when you have what we call a benign and uncancerous tumor in your thyroid, can cause you to have this condition. Now, you can have an uncancerous tumor in your pituitary. Get this point right, in your pituitary. This one will cause the pituitary to stimulate your thyroid gland to release high amount of thyroid hormones. That is how you'll get this condition. Now, others can have a condition which affects your thyroid directly, your thyroid, not the pituitary. Because if you remember the video we did on how the thyroid gland is connected, hypothalamus, it comes to the pituitary and then to the thyroid. Now, the pituitary releases TSH, will stimulate the thyroid gland to release the thyroid hormones T4 and T3. Now, a tumor in your pituitary, that one will cause what we call secondary hyperthyroidism. But when your thyroid gland is affected directly, that one will cause primary hyperthyroidism. When your thyroid gland is directly affected, it's a primary hyperthyroidism. When it affects your pituitary, which will release thyroid stimulating hormone, which will stimulate the thyroid gland to produce thyroid hormones in high amounts. That is a condition we call secondary hyperthyroidism or overactive thyroid. Today, I believe we have talked much in this video, and I believe you have gotten something which can help you all get to help someone, maybe a loved one, get to know what actually is happening to your body. When you know how your body works, you'll be able to make the right decision by making the necessary steps. Remember, we said these conditions of the thyroid mostly affects women than men, reason being the way our body functions or the hormones in our body. So it's good to have this information which will make you make the right decision. If this video resonates with you, kindly give us a comment or give us your experience. Have you ever seen somebody with condition or a loved one, or it's the first time you're getting? Or what's your experience with this if you have been in this condition? Now, if you know someone or you are loving, you feel considerate to someone, share the link and kindly give the video a like. Till next time, stay well and let's meet in the next video where we are going to look at how this condition is managed or how it's treated. Don't forget to subscribe, hit the notification bell so that you get to be notified each and every time I upload a new video. Thank you so much. Bye bye.